Catherine G. McRae, and this is Perspective. My guests today are Lisa Carricato from Canadian Mental Health Association and Pam Lafave from the Canadian Mental Health Association. Maybe we'll start with you, Pam, if you could just tell us your position there with the Canadian Mental Health Association.
Okay, so I'm Pam Lafave, as mentioned, and I'm the Clinical Director at Canadian Mental Health Association, so providing guidance and direction and supervision to our frontline staff.
Thank you. And Lisa?
My title is the Mental Health Educator, so I do education and training in the community, and I spend a couple of half days on campus at both Algoma University and Sioux College as well.
Excellent. So today I thought we could talk about if I'm understanding correctly, there's somewhat of a, is it an epidemic of mental health crisis with suicides today? Who wants to speak to that?
That's interesting. That's the first time I've heard the term epidemic. I know that it's certainly an issue that impacts our community very much so.
I have read from different sources that it's kind of a bigger problem today than ever before.
It is on the rise, and in Canada, approximately each year, about 4,000 Canadians die by suicide. So it is a problem, for sure.
So what can we do to address that? What is happening today? Well, I guess, you know, what's causing it? There's been a couple of high-profile suicides recently in the news. And I understand when that happens, sometimes there's an uptick in suicides happening as well. Is that correct?
I think the most dangerous time for individuals who've been impacted by the suicide of a close friend, family, or loved one is immediately following that suicide. So that's an important time when we have to wrap extra supports and whatnot around individuals just to ensure that their mental well-being is stabilized.
Yeah, and I think that just as you mentioned, there have been some high-profile suicides recently, and it really goes to show you that people who are struggling, it can impact anyone, and so it's really important to remember that there are things that we can watch for. There are things we can do to try to help someone who might be having thoughts of suicide. And if we can teach people what those things are, we'd have a much safer community in terms of losing people to suicide.
Well, I think it's important to understand for the general public as well, like it crosses all sectors, all economic sectors, all demographics, gender, everywhere. It happens. It doesn't matter what your station happens to be in life. It's mental health is a very serious issue that we're seeing more and more problems, I guess you could say, not just the suicide, but other problems in acting out. When you talk about signs to see along the way, how would one identify whether it be their friends or family or even a co-worker? And is it different in a co-working situation than in a family situation? Once you recognize the signs and then what you would do about it. So I guess starting with the signs.
Do you want me to speak to that?
Sure.
Okay. So I don't think it's different regardless of your relationship with an individual. The other thing too is everybody's experience with whether it be stress, depression, any kind of mental health issue it's so individualistic, but there are some typical things that you would be watching for or noticing, and really it's something that's out of character for that individual. So it could be changes in physical appearance, behavioral changes in thought patterns, or in how they're presenting emotionally. So it could be changes in appetite, they're showing up late for work, they're withdrawing from activities that they typically engage in or people that they typically are close to and spend time with. They can be disorganized, have trouble putting thoughts together. It's kind of quite a lengthy list, and it's so individualistic, but just things that are out of character for what you would typically notice for that person.
Okay, and then would those signs be the same in the workplace for a work member?
Yeah, for anyone really, changes in behavior. People might appear to be very down, very sad, saying things like it's hopeless, it's helpless, those kinds of things. So, and the other thing that I want to touch on that you mentioned, it's important to understand that there are often times when someone is having thoughts of suicide or when someone dies by suicide, it's not just about one thing. It's a multifaceted thing, and oftentimes it's, you know, someone is struggling with a great deal of pain.
Okay, we just have to go to break, and we'll be right back with Lisa and Pam from the Canadian Mental Health Association. Please stay with us. Welcome back. I'm Katherine G. McRae. You're watching Perspective. My guests today are from the Canadian Mental Health Association, Pamela Lafave and Lisa Carricato. Just before the break, we were talking about the signs of someone struggling with mental health issues and possibly thoughts of suicide. If you are around someone that you start to recognize those signs that you discussed before the break, what would be an action, or what would be the next step that maybe someone could take to help that person?
So I think if you're concerned about someone, to let them know that you're concerned and have a conversation kind of in that manner, to let them know some of the things that you've noticed.
So how would you approach that with the person? Like say a coworker that you don't know very well, and you know they might feel affronted by you even approaching them.
So I think about being very factual, about noticing some of the changes in them. Maybe perhaps they are missing some work and not returning calls, maybe not joining you in the lunchroom like they used to. So sitting down with them in a quiet area, the two of you, and telling them very specifically, these are the things I've noticed. You haven't been at work lately, you're not returning my calls, and I'm very concerned about you. And sometimes when people start to withdraw and they're going through difficult times, sometimes they need some help. Would you like some help? I'd be happy to help you.
So that would be something that you would do on a one-on-one situation. You wouldn't, you know, ask them in the lunchroom in front of everybody kind of thing.
No.
Okay. And then as far as the help, if they okay, what if they deny that anything's wrong? Is that typical, that they would deny that anything's wrong?
Yeah, I think so, absolutely. So we can certainly approach someone. I think genuineness is really important too. So if a person feels like you're generally coming from a place of care and concern for them, that's helpful. But it's sort of asking beyond that, I'm fine. And really, I think we have to be careful not to alienate people further, because if we're already seeing withdrawal, we don't want to encourage that. But it's just really continuing to check in with them, let them know, you know, care about how you're doing, and I'm always here no matter what, and if ever you do want to talk about something, please feel free to come. But then making sure you follow up, because they might not come to you, and go back again and say, how are you doing today? And just that continual checkup to talk to them, and almost, you know, daily to, how are you doing today, and anything you want to talk about.
And what programs and services are in place at the Canadian Mental Health Association for people that may need those services?
We have quite a few programs and services that are available. Internally, we have our counseling services, so an individual would access that through our central access line. And they can quite quickly get into a single session appointment with one of our counselors, where that individual would assess what their needs are and determine, you know, can they meet those needs in the session, or would they need some ongoing counseling. We have certainly a community collaborative with 5 agencies. On Tuesdays, we provide a walk-in service.
So they don't have to have an appointment,
No.
they could just come in?
Yes.
Or the line that you spoke about, would that be contacting the Canadian Mental Health directly, or through a crisis line?
Nope, that's directly contacting our access worker, who's available from 8:30 a.m. in the morning till 8 p.m. at night, Monday to Friday. And then on Tuesdays, they don't have to call, they can just walk in. First appointment at 11:30 on Tuesdays, and the last appointment starting at 5:30 p.m. And it's just first come, first serve.
Okay. And are there any costs associated with that? So
None.
Okay. And Lisa, I understand you do some training seminars.
Yes, we offer lots of different trainings, both for workplaces and for the general public. And learning how to have conversations with people about mental health is so important. We don't think twice about asking our coworker if we've noticed if they've hurt themselves physically. And mental health is something that we all have and we need to take care of. So if we can teach people that, how to recognize when someone might be having some challenges and how to have those conversations, our whole community would benefit. So one of the trainings we offer is mental health first aid, and that teaches people how to basically recognize when someone might be having some challenges and where in the community to link them to further supports.
Excellent. We'll be right back. We just have to go to break, and we'll be right back. You're watching Perspective. Please stay with us. Welcome back. You're watching Perspective with my guests from Canadian Mental Health Association, Pamela Lafave and Lisa Carricato. Before break, Lisa, you were talking about some of the training programs that you offer corporately, I understand.
Yes.
So you would go into the workplace and offer training programs to
workplaces.
To everybody at the workplace.
Yes. So much like in the workplace, many places are doing first aid and CPR for employees to have a safer workplace. Many workplaces are seeing the value in having their employees trained in mental health first aid as well. So not only do I do these trainings in the community, but do them in lots of different workplaces as well.
So is the training component is to recognize mental health issues, how to take care of your own mental health, and then what to do about it if you're suffering from.
Yep, how to have the conversations and where in the community we can link people for further supports. Yes.
Okay, that's excellent. Pam, you probably deal with this a lot as well. Is there a stigma still around mental health where people are resistant to talk about it? Or still want, even in counseling, still want to hide the fact of what they're really dealing with?
Right, absolutely. I do think that there still is stigma out there, and that's part of the work that we do. Is it's wanting to really provide the education through a lot of the programs Lisa does, but through our everyday work about really it's a sign of strength and it's courageous and it's an important thing to do, because Lisa mentioned already that we all have mental health, and you know, we don't hesitate to reach out for assistance with our physical health, and there's no difference between getting support and assistance with our mental health, because we'll have periods often where we're quite stabilized and we're doing really well, and other times where we need a little bit of support, and there's really no difference.
Yeah, and just to add what Pam was saying about how we all have mental health, the statistics in Canada are 1 in 5 Canadians will have a diagnosable mental illness at some point in their life. But I really like to look at it that 5 in 5 of us have mental health. And so we're all affected. We all know somebody who has struggled, and we all have mental health. So to kind of educate people about that and to really encourage people that if they are struggling, that it's okay to ask for help. Yep. We can prevent things from becoming much worse a lot of times if we get early help and treatment.
Okay, so we've talked about how to recognize some of the signs in other people, whether it be family members, friends, or coworkers. But what about it within yourself? I mean, we all have, you know, good days and bad days, and some days are worse than other days. How do we know ourselves that, boy, this is really going downhill fast and I need to get some help? Is there like a cutoff point? Is there something to recognize within oneself that they should be seeking external help?
I think sometimes it might be harder to recognize it in ourselves than with other people, but again, it's looking for the same things as you might notice in others. We might notice internally the more physical symptoms of it. So do we have a change in appetite? Either we're not hungry or we're overeating, something that's unusual. Are we sleepless, or are we requiring more sleep? Do we have, you know, indigestion, or, you know, or is our stomach upset? So some of those physical signs, headaches, you know, the dizziness, that might be quite unusual for us. But again, irritability and changes in mood or aggression even. Another thing I think can be important to look at is are there increase in some behaviors such as drinking or smoking, or things that could be warning signs that, you know, this is really unusual for me. Why am I doing this? You know, what's triggering some of these changes for me?
And I think really the most important thing to remember is anything that impacts a person's ability to live their life or do the things that are important, that's really when it's time to access some help.
Okay, very good. I'm also wondering, you hear about in other areas functioning and non-functioning. So is there such a thing as functioning? Well, I guess there is, because we just had a high-profile case in that regard. When if the signs are not obvious, maybe to other people, and maybe they're keeping up a front with their job, what should they be looking for within themselves to say, you know what, I need to get help and I need to get it right away? Is there a length of time, or, you know, the first bad day, are you calling?
That's probably the best time to reach out, truthfully, but I think that would be unusual for a first bad day, because I think our natural tendency is to think, you know, tomorrow's a new day and I'll feel better, and yeah, I don't know that we could put a time frame on it, because it depends, again, so individualistic. It's really knowing I'm in trouble here, or something is really different and I need to be worried about it, but it's sometimes difficult to have that self-awareness.
Okay, we have to go to break and we'll be right back. You're watching Perspective. Please stay with us. I'm Katherine G. McRae. You're watching Perspective. My guests are from the Canadian Mental Health Association and Sault Ste. Marie, Pamela Lafave, Clinical Director with Canadian Mental Health Association, and Lisa Carricato, Education Training with Canadian Mental Health Association. Lisa, before the break, we were talking about training, recognizing signs of mental health issues. Not all mental health issues lead to suicide, obviously. Some people have some really bad days, or maybe they go through some some periods in life where things are not that great.
Absolutely.
How do we make those distinctions, and what do we do about it?
So we all have bad days. We all go through challenges. That's part of life. And when we face challenges, sometimes we have some days where we don't want to be around our friends and family, where we kind of withdraw. And that's for a few days. And that's part of mental health, responding to situations in that way. Not everyone who has challenges with their mental health or who struggles with mental disorders has thoughts of suicide. It puts you at higher risk, but not everybody does. So I just wanted to make that clear distinction.
Sometimes you just want to lock your family out of the house and get some peace and quiet, right?
Right. But for people who do have thoughts of suicide, it's important to know that it is common for people to have thoughts. It's not as common to have plans or to actually act on those thoughts, but it is common. And so to be able to tell people that when you want to have a conversation, if you're concerned, it's very important.
Okay. And with that, and the programs, is that part of your training as well, to recognize that distinction in your corporate training as well?
So we offer training anywhere, either corporately or in the community. There is a 3-hour training called Safe Talk, and it's a basic training that teaches individuals how to recognize when someone might be having thoughts of suicide, how to ask them directly about those thoughts, and then where in the community we can link that person to further help and support. And then I also do a 2 full-day training called Applied Suicide Intervention Skills, and that teaches you how to do a suicide intervention with someone who is at immediate risk of acting on thoughts of suicide.
Okay. And I notice now, at least in the last year, there seems to be a lot more focus on mental health and mental health programs. And I think, if I'm correct, maybe there's less of a stigma today than there was, you know, even 2 years ago, 2 or 3 years ago.
I think there may be less, but it's still alive and well, that stigma around mental health.
The stigma is still alive and well?
Yeah,
Okay.
yeah, it is.
So people are not seeking help when they should
I think there are. I think it's getting better, but I still think we have a long way to go.
Yeah. And the statistic in Canada is 2/3 of the people who are living with mental health challenges don't get help because of the stigma that's attached to it.
Okay, we'll be right back. We're going to break, and please stay with us. Welcome back. You're watching Perspective. I'm Katherine G. McRae. We're talking about suicide prevention with the Canadian Mental Health Association, Pamela Lafave, Clinical Director, and Lisa Carricato, Education and Training. So what do we do when we want to speak with someone that we recognize some signs or issues? How do we approach them and speak to them? I know we talked about, how are you doing today? But what is the best approach? Is it beat around the bush, or is it to be direct?
Direct is the only way to be. If you're concerned that someone could be having thoughts of suicide, the best way to find out is to ask directly, are you having thoughts of suicide?
So it's more important to ask that than to worry about offending the person by maybe being wrong.
That's right, because suicide is about life or death. So if you're concerned about someone, you need to ask directly. Some people might be afraid that they might put the idea into a person's head, and human beings don't work that way. We're not that easily suggestible. Not asking if you're concerned hurts, but asking never hurts.
Okay. And from your perspective, Pamela, how are you finding dealing with clients that maybe are, coming to you and still hiding the fact that they might be suicidal?
How am I, sorry?
How are you interacting with clients that you sense are still hiding that?
Right. So I don't do direct practice right now, but in terms of when I did have quite an extensive history working directly with individuals. Like Lisa said, it's just asking. It's continuing to ask them, I have these concerns, these are the signs and symptoms that I see, and I'm worried. And are you having the thoughts? Okay, so we can make a difference. Individuals can make a difference and help, and reach out and help. Okay, I think, thank you both for being on the show today. Is there a phone number that we can give to our viewing audience if they need help themselves or know someone that needs some help? Yep, there are a few places that we would recommend. You can certainly call us, our central access line at 705-759-5989, 5989, or crisis at Sioux Area Hospitals,
which is 759-3398.
Okay, so it's important. We want our viewers to know if they're struggling, to reach out. Very, very important. And if you recognize someone struggling, to reach out to them as well.
Absolutely.
Okay. I want to thank you both for being on the program today. Pamela Lafave, Clinical Director for Canadian Mental Health Association, and Lisa Carricato, Education and Training, Canadian Mental Health Association. Thank you both for joining me today and discussing such an important topic.
Thanks for having us.
Much appreciated. Thank you. You're watching Perspective. I'm Katherine G. McCrae. Till next time, what's your perspective?